We have one of my favorite cases today, a degenerative spondylolisthesis with back pain and stenosis at a single level. You can tell on flexion extension views there's motion, and then on MRI there's lots of facet arthropathy, stenosis, bulging discs, ligamentous hypertrophy, and stenosis. So we'll do a minimally invasive lateral interbody reconstruction because he's young and very active. Get a big implant in there and really provide stable fixation in the front, improve his lordosis and bring him back a little bit and stabilize him. And just by realigning the disc space, we will tension everything up and indirectly decompress the stenosis, and we'll just be able to fix him from the back without exposing the dural tube and getting blood all around there. And I anticipate a great result, and if all goes well, he can either go home tonight or tomorrow morning. All right, I've got the navigation system going. I've got the initial retractor in. I'm doing shallow docking. And look at this, is cheating. I got it set perfectly. Lock that down. Now I'm going to look down there, expose the psoas, and dissect through the psoas under direct vision. Hence the name direct look technique. Greatly decreases trauma to the psoas muscle and greatly increases the safety of the procedure, because I can make sure that I don't grab any vital structures on the way down. Because you know what my mama always said, spine surgery would be a lot easier without blood vessels, nerves, bowels, kidneys, aorta, vena cava. What else is down there? Not much except those vital structures. Light on. I've got the retractor down. I'm looking at the disc. I'm doing the discectomy. It's a beautiful view. I have exposed exactly what I need. No more, no less. That's one of the tenets of minimally invasive surgery. Don't make a big incision for a small surgical target site. Try to make your surgical corridor as much in line with the target site as possible. And the target site is only 22 long by 10 or 12 tall. That's a tiny surgical target site. So we want the surgical corridor to match that up as much as possible. In traditional open surgery, the surgical corridor is like a funnel with the opening really big, then narrowing down to the surgical target site and blasting everything along the way. Regular tuitary. And we abhor that kind of surgery, but don't tell anybody else that. Alright, you have the cage. Very expensive, expandable, almost pure titanium. Perfectly shaped to fit in here. Oh yes, get ready for fluoro. At the anterior vertebral body line, I think. No? Yes. Uh-huh. Showing up is shot. Okay, let me have the, I have to back this up somehow. Let me have the little side thing. Okay, expanding away like a car jack. I have tons of tactile feel here. Head back down. So far so great. Got a really nice expandable spacer in here. Really good fit. No bleeding. Minimal incision size. I like it. Alrighty, the front side went really well. Really well. Now I'm doing the back part to lock everything down. The facet joints are unbelievably arthritic. Which makes perfect sense. Opened up Radtech, perfect. Alrighty, so I made the perfect starting hole, and now I'm using the thoracic probe to find my way down this bony tunnel called the pedicle. And you can see it just invites me in. Now this is an interesting level. Look at the entry point of this one. It is on the downward slope. really hard to get a jam sheeting needle to go in that direction, but once you make the perfect starting hole with a burr, now the thoracic probe just guides you in, using tons of tactile feel and just letting it fall in. Oh, that's going to be a perfect screw. I made the holes on all 4 things all at once. And it is amazing how easy it is to find this hole again. It's going to be a perfect screw too. Now for the screw, this definitely pulls you in. I'm not pushing at all. Oh yeah, it's a good bite too. It's cheating, I know, but like my mom always said, if you don't cheat every once in a while, you ain't trying hard enough. Oh, that is a good bite. Thank you for having such great bone. More of the same, other side. Ooh, this is a good bite. My forearms are going to be massive by the end of this case. Feel the burn, baby. Ooh, that's going to be a good bite too. And let's undo the x-rays look so good so far. Can you tilt, wag one way or the other? Oh yeah, wag a little bit more.